I'm Costa Nicolopoulos. I'm a DHCC registered specialist oral and maxillofacial surgeon, and my main interest in my field is dental implants. In particular, the way we do implants is a little bit different from most other people, in the sense that we extract teeth, place the implants at the same time usually, and in most cases place the teeth all in the same day. So the patient has an accelerated type of treatment. He has his dental extraction, his implants, and the teeth placed all in the same day in almost all cases. Dental implants were developed by a brilliant Swedish orthopedic surgeon by the name of Professor P.I. Brannemark. His protocol was placing the dental implants, waiting for a healing period of 4 to 6 months, then exposing, in other words, finding the implants under the gums and placing the teeth over them. Now, that protocol, that delayed healing protocol, carried on for sort of 25-30 years, and then in the late 90s a protocol of loading these implants immediately started becoming popular. And the way we do implants is the non-delayed method, in other words the accelerated method, which we call immediate loading. So implants have developed from a slower process to a faster process, and the reason why we can do implants in this more accelerated or quicker method is because the titanium, that's the material that the implants are made from, has undergone a surface enhancement treatment. In other words, it's still pure titanium, or most dental implants are made of commercially pure titanium. Some companies do make titanium alloys, but the important thing is that the surface of the titanium is treated and is made rougher so that the surface area is bigger and the bone grows onto this surface much faster, and that's why we can do what we call immediate loading. Also, the shape of the implants has changed. The geometry of implants has changed from a parallel type of screw to a more tapered type of screw. So as the implant goes in the jawbone, it fixates in a much more stable method. So the fixation methods have improved. And the third and very important innovation which allows us to accelerate treatment is placing these implants in an angulated fashion, not in a straight parallel fashion the way we used to, thus avoiding areas of poor bone and making use of native bone, native available bone. So we don't necessarily have to do bone grafts in all cases. We can avoid bone grafting, which is a costly, painful and time-consuming part of the treatment. We can avoid that by placing implants in an angled fashion, and also by using site-specific implants. Different parts of the mouth require different sizes of implants, wider, shorter, longer, narrower implants. And all these together allow us to do accelerated dental implant treatment. The benefits of implants are that it is a method to replace lost teeth. They are a very reliable tooth replacement method, and having said that, it doesn't mean that you don't have to look after them. So you can't just forget about them, you have to maintain them. How do you maintain them? You maintain dental implants by cleaning them daily, home care, the way your dentist should show you. And also you have to present to your dentist that placed the dental implants or the dental implant prosthesis. You should attend for a follow-up appointment twice a year so that any cleaning or maintenance can be done. So it's not something that you can just forget about. More common age group are patients in their 50s and 60s. However, we also do see young people who are born with one or more congenitally missing teeth, and they need to have these teeth replaced by either a bridge, which is not the best anymore, or by a dental implant. We then see patients with sports injuries, young people that have lost a tooth from a sports injury, and of course there are other accidents like motor car accidents, falls, etc. But the bulk of our patients are the second age group. Traditionally, it's anything between 3 months and 9 months, depending on whether bone grafting is involved. And that's by using the conventional waiting time, 3-month waiting time period, which we don't conventionally practice. We practice immediate loading, the so-called accelerated dental implant treatment, where the patient has his implant and tooth placed all in the same day. So there's basically no waiting time if you use our protocol. We differ in the way we in the way we manage our dental implant treatment. In other words, our protocol is you come in, you have your assessment or consultation, a discussion, and then we proceed with having your dental implant placed. And if it's a single implant, one tooth, you can have the permanent tooth done all in the same day. If it is multiple teeth, like for example the whole jaw, you get temporary good fixed screw retained teeth on the same day, and you get the permanent teeth a week later. So we differ from most other dental implant practitioners in the sense that we treat our patients on the same day method, which means same day you get at least temporary teeth, fixed teeth, not something that is removable.